Welcome to Backyard Forestry. I'm Rich Kelsky, Vice President of the New Jersey Forestry Association. Tonight's presentation is Tick Talk, featuring Emily Struckhoff, Extension Program Specialist of Penn State Extension Vector-Borne Disease Team. This presentation is for general informational purposes only and is not intended to constitute specific legal, tax, professional, or other advice. No claims, promises, guarantees are made about its accuracy, completeness, adequacy, or suitability. We encourage landowners to seek professional advice from their attorneys, accountants, foresters, and other professionals concerning their woodlands and otherwise. The New Jersey Forestry Association is a 501c3 nonprofit organization. We advocate for all forests in New Jersey by supporting responsible, sustainable use and science-based forest management. We are the voice of woodland owners in New Jersey, both private and public, commenting on legislation, regulation, rulemaking, and projects affecting the forests of New Jersey. We are a principal provider of forestry education and advocacy programs in New Jersey. And we are a primary forestry resource to officials, regulators, and legislators. If you've been enjoying our backyard programs, please support the New Jersey Forestry Association by visiting njforestry.org. That's njforestry.org. You can also use the QR code, which is on the screen. A few words about ticks in New Jersey and ticks in general to set the stage for this presentation. Back in 1975, juvenile arthritis cases in Old Lyme were discovered with a link to tick bites. In 1978, we saw the first cases of Lyme disease in New Jersey, centered in central New Jersey, Monmouth County. In 1981, Lyme disease reporting and tracking in New Jersey was started. In 2002, a Lyme vaccine, which had been previously issued, was pulled from the market. We have a long list of tick-borne diseases today, and that's just some of them that I put on the screen here. We'll hear about those later in the presentation. And so in some, we have more ticks, more species, more diseases, more sprawl, more deer, more mice, more invasives, warmer, wetter weather, I had to practice that, and more spread. And that's what we'll be hearing about this evening as well. Keep in mind that New Jersey is among the highest incidence states. So that is very important for you to be here, and we appreciate your attending. Tonight's guest is from Penn State Extension. Emily Struckhoff is an extension program specialist on Penn State Extension's Vector-Borne Disease Team. Emily received a BS in biology from St. Louis University and an MS in entomology from the University of Illinois, Urbana-Champaign. Her past work has included conducting tick surveillance throughout Illinois and testing ticks for bacteria and viruses of medical concern. At Penn State Extension, Emily develops and delivers programming about vectors such as ticks and mosquitoes throughout the state. And now, the New Jersey Forestry Association is proud to present Tick Talk, featuring Emily Struckhoff of Penn State Extension.
All right. Hi, everyone. Thank you so much for having me today, and thank you all for tuning in this evening to learn a little bit more about ticks. And so to get started, I'm going to go ahead and share my screen, and then we will get going. All right. Let's see. Can you see my screen all right?
All good.
Perfect. Great. Then we'll get started. So once again, thank you all so much for having me here today. I'm very excited to be joining you guys. Like you just said, my name is Emily Struckhoff. I'm from just a little bit west of y'all out in Pennsylvania. I work for Penn State Extension and specifically do a lot of work with ticks and tick-borne diseases. So today we're going to be talking about what ticks are, what tick-borne diseases there are in the Northeast, and how to prevent tick bites. So before I get started, I do have some general housekeeping slides. First off, if you are not familiar with Penn State Extension or just university extensions in general, our mission statement is we believe that all people should have access to science-based education. Folks who work throughout who work for Extension work all throughout the states where they're based. I'm out in central Pennsylvania, but there are lots of folks with Rutgers Extension. I know I saw some people, some Master Gardeners tuning in the chat who work all throughout New Jersey as well. And we cover a lot of different areas at Extension, from 4-H and youth development, agronomy, natural resources, animal systems, health, food, all sorts of different topics. And once again, my name is Emily Struckhoff. Up on the screen is my email. I will also have it at the end of the presentation as well. So if after today's presentation, there are some questions that we don't get to, or if you'd like to reach out or have any questions that come up later on after the presentation, please feel free to reach out, send me an email. I'm always happy to chat. And last bit of housekeeping things before we get started. Throughout today's presentation, because we were talking about ticks and tick-borne diseases, we will be discussing some different tick-borne diseases that there are in the Northeast. However, I'm not a doctor, I'm not a medical professional, and this presentation is for educational purposes only. It is not intended to be a substitute for medical advice, diagnosis, or treatment. And so with that, we can go ahead and get started. So once again, what we're going to be covering in the next 45 minutes, hour or so with the Q&A is we're going to start off by talking about what ticks are, so what they look like, what their life cycle is like, where they live. We are then going to be talking about different tick species in the Northeast and what diseases those ticks are associated with. And then finally, we're going to be wrapping up by talking about what steps you can take to prevent tick bites. And let's see, to go ahead and get started, first off, what is a tick? I'm assuming most people on the call today, if not everyone on the call, has encountered ticks before. You are familiar with these. But if you have not seen a tick before, or if you have not seen a tick really up close before, there's going to be a lot of very large photos of them throughout the presentation. You'll know what they look like by the end. And up on the screen is a photo of what a tick looks like. A couple of things to note about ticks. First off, ticks are arthropods. They're actually not insects. They're going to be more closely related to things like spiders and mites than they are insects. And you can tell if you find something crawling on you in the woods, you can tell if it is a tick versus some other sort of arthropod or insect by looking for a few different features. The first thing you'd look for is the number of legs that it has. So ticks have 8 legs as adults. Like I said, they're going to be more closely related to things like spiders and mites. So they're going to have 8 legs, and this is opposed to insects, which only have 6. Ticks are also going to have 2 separate body regions. So if you think back to maybe some old science biology classes that you may have taken, you probably learned that insects have 3 body segments. They've got a head, they have a thorax, and they have an abdomen. Ticks are a little bit different because they have just 2 body segments. The scientific terms for these are the capitulum and then the idiosoma, but you can also just think of it as they have their mouth parts and then they have the rest of their body. And so the last thing to note about ticks in general is that ticks have something called a hard dorsal shield on their back. So has anyone here in the audience ever found a tick on yourself before and you tried to kill it by just squishing it in between your fingers? If anyone has tried that before, how did it work? Did it work super well? Well, if you haven't tried it before, or if you tried to do it before, I see, yes, someone says burn it, someone said no. Not that well. Yeah, a lot of times ticks, if you've had one before, you tried to squish it to kill it, a lot of times they are kind of tough and kind of difficult to squish. And that is in large part because they have this hard covering on their back that, requires much force, only with pliers, somebody else said. Yes, ticks are really not that easy to squish and kill. And that is in part because they have this hard covering on their back called a dorsal shield. All right, so next up, we have a little bit sort of pop quiz here. Very quick one, nothing too crazy. Is up on the screen are 3 insects or arthropods that are commonly found on people or wildlife in the Northeast. One of these is the tick, the other 2 aren't the tick. So take a second and see if you can point out which one of these is the tick and which one of these is not, which one of these are not the ticks. And yeah, I already see people are putting in the chat. Yep, you guys are experts at this, absolutely. Everyone is right. The arthropod on the far left is going to be the tick. You can tell that one is the tick as opposed to something else because once again, it's going to have 8 legs. It has those 2 body regions, and you can't tell just because it's an image, but if you were able to hold it, you'd be able to tell it has that kind of harder outer covering. If anyone was curious, the other 2 insects over here on the screen, in the center, that is a bedbug, and on the far right is a deer head. If anyone here is not familiar with deer heads are a kind of biting fly that you'll often find on deer, or in Pennsylvania, we also have them on our elk up here. And you can tell that the bed bugs and the deer heads are not ticks because once again, they're going to have 6 legs. They have those 3 body regions because they're insects. And if you could feel them, you'd feel that they're a lot easier to squish and kill. All right. So a few other things just to note about ticks in general. First off is how ticks feed. So ticks feed on blood, but unlike other arthropods like mosquitoes, which come in, bite right away, and then go away and leave their host animal that they're feeding on behind, ticks will stay attached for quite some time once they bite. Generally speaking, a lot of the ticks that we have in the Northeast will feed for about 7 days on whatever animal they're attached to if you'll let them. And during these 7 days, their appearance changes quite a bit. So over in this image on the far left is a tick that is unfed. So a tick that has not attached to an animal. We'll call these animals the hosts of the tick. And then over here on the far right is a tick that has been attached to an animal and has completely fed. So it's been attached for as long as it wants and it is fed on blood. And as you can see, as the tick goes from unfed to attached for 7 days, it grows quite a bit larger in size. And we call this engorgement. And this is important to note for a couple of reasons. First off, it's good to note that if you find a tick on you, it can look very different depending on how long it has been attached. The size of ticks can vary quite a bit depending on how long they've been feeding on their host animal. But it's also important to note because you can actually use how long or how large a tick is to estimate how long it's been attached. So if you were to find a tick on yourself or your dog or a pet that looks something like this, that is a bit smaller, that means it probably hasn't been attached for as long. Versus if you find a tick on you that is a lot larger, maybe it's turned this grayish, color, that's a sign that it may have been attached for quite some time. All right, so moving right along, the next thing I'm going to talk about is the life cycle of ticks. So how ticks actually grow and develop. And for most ticks that we have in the Northeast, they're going to live for about 2 years, which is quite a long time for an arthropod. A lot of arthropods don't live for that long. And during these 2 years, they're going to go through 4 different life stages. So ticks, like many other arthropods, are going to start off as eggs, and those eggs are then going to hatch into larvae. Tick larvae, if you've ever seen them before, they are very, very small. You can't see them with your naked eye, but it is a little tricky. They are very, very tiny, and they are only going to have 6 legs instead of 8 legs like the older life stages have. Those larvae are then going to go out and do what we call take a blood meal, which just means that they're going to go out and they're going to look for an animal to feed on. So that could be a mouse, that could be a chipmunk, that could be another species of animal, depending on what species of tick we're talking about. But they're going to go out, find an animal to feed on, drink its blood before they drop off and molt into the 3rd life stage, which are nymphs. Nymphal ticks are going to be a bit larger than the larvae are. This is also when we see ticks start having 8 legs instead of 6. And those nymphs are going to do the exact same thing. They're going to go out, they're going to find an animal to feed on, take a blood meal before they molt into adults. Adults are the 4th and final life stage of ticks. This is also where we see a difference between male and female ticks. There is no difference in the younger life stages. And at this point, only the female ticks are going to go and feed on one more animal. So they're going to go out, find an animal, feed one more time before they drop off. After that, male and females will mate, females will lay eggs, and then the whole cycle starts all over again. And so why do we bring this up? Once again, it's kind of for 2 different reasons. First off is that these different life stages of ticks, so the larvae and the nymphs and the adults, can all look quite different. So it's good to note that there are different life stages because the ticks that you find can look a lot different depending on what life stage they are. But it's also important to note because each of the times that these ticks are feeding on a host animal, so each of the times during its life that it's taking a blood meal, is an opportunity for that tick to either pass up or transmit a bacteria, a virus, or some other disease agent. Many of these bacteria and pathogens are not, ticks are not born with these pathogens. Most of the time, they'll pick them up from the animals that they feed on and then pass them on to the next animal that they feed on. And that is how tick-borne diseases get spread and circulated in the environment. So last thing I'll talk about when we're just discussing ticks in general are how ticks are actually finding the animals that they're feeding on. Ticks have a whole wide forest, they have a whole wide world out there. How are they actually finding their host animals? For most ticks, they're going to do this through a behavior called questing. And so this video here, if it'll play, yep, there it goes. This is a video that I took when doing some tick surveillance out in Illinois, where you can see a tick doing this questing behavior. And essentially what it's doing is it is crawling onto this small plant and waving its front legs around in the air. Ticks have sensory organs that can help detect cues in the air that may signal that some sort of animal that it can feed on is nearby. So things like carbon dioxide or other chemical cues in the air. When ticks sense this, they'll crawl on to a blade of grass, a small plant, and wave their front legs around in the air. And then when that animal brushes by, they can grab on and crawl around until they find a spot to attach. So ticks are not found in trees. They cannot jump. This is the main way that most of the tick species that we encounter when we're out in the forest are finding the host animals that they're feeding on. So with that, moving on, now that we know a little bit about ticks in general and the tick life cycle, I'm going to pivot into talking about different species of ticks that we find in the Northeast. So worldwide, there are around 900 different species of ticks, which is quite a lot. In the United States, we have about 70 different species, which is a lot and sounds like a lot, but I'll call it good news here is that most of these ticks you will never encounter. A lot of tick species are going to be very specialized to feed on one host or a group of hosts. So for example, there's one tick species, the scientific name is called Hemophysalis leporus palustris. It's a very long name, it's quite a mouthful, but its common name is the rabbit tick. And it's called the rabbit tick because it feeds mostly on rabbits. And unless you are working with wild rabbits a lot, unless you're spending a lot of time interacting with wild rabbits, you'll probably never encounter that tick species. So with that, when it comes to the ticks that we actually find on people or companion animals or livestock in the United States, especially in the eastern United States, it's really only a handful that are known to commonly bite people or those companion animals and livestock. And so with that, I'll have, if folks could put in the chat, has anyone here heard of any specific tick species before? What kinds of ticks have you heard about? All right, I see somebody put Lone Star in the chat, blackleg, deer ticks, a couple of deer ticks, black-legged deer ticks. Yes, dog ticks. Yeah, you guys are hitting all the main ones. Absolutely. So yeah, you guys know a lot about this already. When it comes to the Northeast, there are about 4 or 5 different species that you can commonly encounter depending on where you are. I'm going to talk a little bit more about each of these on the following slides, but to give you a little preview about what we're going to go over, this tick over here on the far left is the black-legged tick. It is also called the deer tick. So if you hear the terms black-legged tick and deer tick, they're referring to the same species. Over here on the right is the American dog tick. Down here on the far left is the Lone Star tick. And then this one down here is the brown dog tick. We're not going to be talking about the brown dog tick as much today because it is actually mostly an indoor pest. You don't find it in forests too much, but I will go into a little bit more detail about these other 3. And with that, I'll start with the black-legged or deer tick. So the scientific name for this tick species is Ixodes scapularis. And it is the most common tick species throughout much of the Northeast and the upper Midwest United States. This tick really prefers to live in forested areas. You'll often find it in places with a lot of canopy cover, a lot of leaf litter, shrubbery that it can live in. You really tend to find it more in these forested areas. This tick is also very much a generalist with what it feeds on, meaning that unlike those tick species that I mentioned earlier that are very specific about what host animals they feed on, the black-legged tick or the deer tick is not. They will feed on all different sorts of mammals, birds. I've pulled these guys off of reptiles before and lizards. So they will feed on a very wide variety of animal hosts. If you find a tick and you're trying to identify if it could be a black-legged tick or a deer tick, a couple of things to look for. First off, the adult females of this tick, so you can see on the right side of this slide, are going to have a reddish-colored abdomen when they're not engorged. So that can be one way to help identify them. The males are going to be all black in color, and the nymphs are kind of this combined black and tan color and are much smaller than the females and males are. And so why do we talk about this tick species in particular? This tick is associated with multiple different diseases, including Lyme disease. So I have a few slides that I'll talk about to go in a little bit more detail about Lyme disease, but Lyme disease is the most common tick-borne disease in the United States, and it is particularly prevalent, as we were talking about when the webinar began, in New Jersey and in the Northeast. Another thing I'll mention here before we get on to the next slides is that tick-borne diseases are actually specific for the species of tick. Not every species of tick can transmit every bacteria or virus out there or cause every tick-borne disease out there, which is why when we're talking about these different tick species, I'll be talking about, or at least mentioning, which tick-borne diseases are associated with them. So for the black-legged tick or the deer tick, other than just Lyme disease, this tick can also transmit some other bacteria and viruses, including the bacteria that cause diseases like anaplasmosis, babesiosis, as well as Powassan virus. So while I will be talking mostly about Lyme disease on the following slides, this tick species is associated with a few other tick-borne diseases as well. And so to talk a little bit more specifically about Lyme disease, like I said, it is the most common tick-borne disease in the United States, and it is caused by a bacteria called Borrelia burgdorferi, which is transmitted by these black-legged ticks, also called deer ticks. So when we're talking about symptoms of Lyme disease is a very complex infection that can affect different systems within the body, including skin, joints, your heart, and nervous system. And in the early stages, or first 3 to 30 days, some potential symptoms of Lyme disease can include fever, chills, muscle joint aches, and the erythema migrans rash. This is also called the bullseye rash. So if you've heard of one symptom of Lyme disease, it's probably this one. There's a photo of it in the top right side of the screen right there. And it is what it sounds like. It's a rash that looks like a bullseye. And this occurs in about 70 to 80% of Lyme disease cases. So it does not occur in every single case of Lyme disease that is out there, but it is a symptom that is very specific for Lyme disease. Lyme disease can also cause other symptoms later on in the infection, including arthritis, severe headaches, rashes, facial palsy, dizziness, shortness of breath, and inflammation of the brain and spinal cord. So this is a disease, like I mentioned, that can affect many different systems and can have many sort of non-specific symptoms. And I'll mention this both here and I'll mention it later on in the presentation as well. If you are ever bitten by a tick and you are concerned about Lyme disease or other tick-borne diseases, always recommend talking with a healthcare provider about what next steps make sense for you. And to talk a little bit more specifically about New Jersey, these are some maps and some data I pulled specifically about Lyme disease cases in New Jersey. And these are from 2024, which is the most recent data that I could find. In 2024, there were over 6,200 cases of Lyme disease diagnosed within New Jersey. The map over on the right shows which counties in New Jersey had the highest prevalence of Lyme disease, so which counties had the most cases. And the graph on the left shows what months these cases were occurring. So from January to December, when were Lyme disease cases being reported within the state? And as you can see, there is a spike in the middle of the year. So in June, July, right around this time of year, when these cases were being reported, in large part because this is the time of year when a lot of these ticks are going to be out and about and active. And we'll talk a little bit more about that later. I saw it in the chat earlier. I don't have it on this slide, but somebody also mentioned, I'm scrolling through the chat right now to try to find it, the Rutgers tick resources. Yes, so Rutgers University in New Jersey also has lots of tick resources on their website. So that is another great place to go if you're looking for specific information about ticks, specifically in New Jersey. Let's see, someone put it in the chat. Yep, someone put it in the chat. Thank you so much. Thanks for providing that. So if you'd like to see more resources or learn more about specifically what's going on in New Jersey, definitely check them out as well. And I should mention that this data right here came from the New Jersey Department of Health. So if you're also if you want to look more into this data and see what information is out there about tick-borne disease is in New Jersey, this dashboard is available on the New Jersey Department of Health's website. So the last thing I'll mention here about Lyme disease before I start getting into some of the other tick species and tick-borne diseases, so I did want to cover a couple of other sort of notes about treatment for Lyme disease and diagnostic tests. So first off, before the webinar, we had some questions come in about diagnostic tests for Lyme disease. There are diagnostic tests for Lyme disease that are available. How these tests works is they are antibody tests. So they do not test for the bacteria itself. They test for the antibodies that your body creates to protect itself from the Lyme disease bacteria. So what that means is that these tests generally tend to reach their greatest accuracy from 4 to 6 weeks after infection. So they will not detect the Lyme disease infection immediately once it happens, but they are highly accurate later on. Another thing to keep in mind just for Lyme disease in general, or treatment, for Lyme disease treatment in general, I should say, is that early treatment is very key for Lyme disease. So once again, if you have concerns, always reach out, talk to your doctor, and talk to a medical professional. And then finally, the last thing I'll mention here is that there is a new human Lyme disease vaccine in development. This is being developed by Pfizer and Valneva. And it just recently, this past March, finished up phase 3 clinical trials, which is the human clinical trial stage. So prior to that, for the last few years, there have been human clinical trials going on throughout the Northeast. And the results of it were they found that this new vaccine had over 70% efficacy at preventing Lyme disease in the folks who received it. So this vaccine is not available yet. It is still in the process of going up for approval. And so there's still several steps to go before it would be available on the market. But this is the farthest that a human Lyme disease vaccine has made it in development since LymeRx was available in the early 2000s. All right, and so with that, we're going to keep moving along. And the next thing, I'm going to go back and start talking about some of these other tick species as well. So going back to the ticks, to different tick species, another tick that is quite common throughout the Northeast and really throughout much of the United States in general is the American dog tick. Scientific name for this tick is Dermacentor variabilis, and this tick is very widely distributed throughout the eastern United States. If you find one of these ticks, you can identify them because they're going to have this kind of white patterning on their back. On the females, it covers half of its back. On the males, it covers the entire back of the tick. And this tick is a species of medical concern because it can transmit the bacteria which causes Rocky Mountain spotted fever. Rocky Mountain spotted fever is the second most common tick-borne disease in the United States after Lyme disease. And moving right along, the next species that I'll talk about is the Lone Star tick. So the Lone Star tick, scientific name is Amblyomma americanum. If you're looking at the images of the ticks on the screen right here, you can probably guess how they got their name. The adult females of this tick species have one big white dot on their back, makes them very easy to identify, and that's why they are called Lone Star ticks. And this is a tick species that was historically found mostly in the southern United States. However, over the last several years, the range of this tick has been expanding northwards. So we're starting to find it further and further north than we did in the past. And at this point, you can find it throughout Pennsylvania, you can find it in New Jersey, and other areas in the Northeast. One note I'll make about this tick is if you ever do find it, is that they have a very unique sort of larval questing. So when the larvae for this tick species hatch from their eggs, instead of hatching and going out into the environment like many other tick species do, what they'll actually do is that when these larvae hatch from their eggs, they will often all stay clumped together. So they will all stay clumped together on a blade of grass, a small plant, all in one spot. And what happens is that when a potential host animal brushes by wherever those ticks are clumped together, instead of one tick, kind of falling off or getting onto the animal that they're feeding on, all of the ticks will transfer off of this blade of grass or plant onto whatever animal that is. And so what this looks like, and the reason why I bring it up, is that if you run into Lone Star larvae when you're out in the woods, a lot of times it can look something like this. This is an image of a key, and each of those little dots that are all right next to this key are all larval Lone Star ticks. So oftentimes we'll call these tick bombs when we find them. And so often when you're finding these larval ticks of Lone Stars out in the woods, you're often not finding one, you could potentially be finding hundreds at a time. So just want to make you aware if you encounter something like this when you're outdoors, this is what it could be. A few other notes for Lone Star ticks. Lone Stars are associated, once again, with several different tick-borne diseases, including ehrlichiosis, tularemia, stari. But the one I will mention specifically here is alpha-gal syndrome. Alpha-gal syndrome has been in the news a lot recently. If you haven't heard about it, it is not a tick-borne disease per se, but it is an allergic reaction that can be caused by the bite of a tick. Essentially what happens is that these Lone Star ticks have a molecule in their saliva called alpha-gal. And in some cases, when somebody's bit by these ticks, it doesn't happen every single time someone is bit, but in some cases, when one is bit by one of these ticks, that molecule in the tick's saliva will go from the tick into the person that it's biting. And that person, their immune system will recognize that alpha-gal is not supposed to be here. It is not a molecule that is found in humans, and will produce antibodies or an immune response against it. Which in the moment that happens, but what can happen later on is that this molecule, this alpha-gal molecule, is also found in different mammal meat products. So things like beef, pork, venison, as well as other mammal products like dairy products. And so for some people, once they've been bitten by these ticks, they can then have an allergic reaction to these mammal meats or dairy products. So this is something that is becoming more common. We know it occurs throughout a lot of the United States, and it is something to be aware of, and it is something that there's still a lot of work being done on. And if folks have other questions about alpha-gal or about any of these other tick species at the end of the presentation, we can certainly talk more about them then. So with that, the other thing I'll talk about specifically for different tick species is invasives. So just like when you're talking about invasive plants or other animals that are invasive, invasive species are always going to be a concern. And one specific tick species that is an invasive of concern in the United States is the Asian longhorn tick. So the Asian longhorn tick, if you have not heard of it, there's an image of it over there on the left. It was first found in the United States on a sheep in New Jersey back in 2017. Although some retrospective studies have actually placed the first collections of this tick in the United States in 2010 in West Virginia. So it's been in the United States for at least 15 years or so. It is native to East and Central Asia. And since it has been introduced in the United States, it has spread to about 25 different states and Washington, D.C. So this map on the screen right here shows up to date where this tick has currently been identified in the U.S. If the county is shaded in on this map, either in red or orange, that means Asian longhorn ticks have been collected there. So if you look at the map, you can see that most of these ticks have been collected sort of up and down Appalachia throughout the eastern United States, but it has also been found as far west as Oklahoma, Kansas, Arkansas, Missouri, and it is something that is being very actively tracked and monitored. So why do we care about this tick species other than just the fact that it is new and it is spreading to different places? Once again, it's going to be for a couple of reasons. First off, populations of this tick in the United States are what we call parthenogenic, which just means that the female ticks can reproduce without a male. In the United States, in fact, there's only ever been 1 or 2 male ticks found. Very few male ticks of the species have ever been identified. Other than that, populations are entirely female. And what this means from the perspective of it being able to spread or move to new areas is that it only takes one of these ticks being introduced to a new spot to start up a whole new population. That's one of the reasons why it's been able to spread so quickly throughout so much of the United States. The other reason why this is a tick of concern is because of the animals that it feeds on. This tick is mostly a pest of livestock and deer, and specifically in livestock, it can cause a disease called theileriosis. This is a disease that affects cattle and can be quite serious in cattle and is of specific concern for livestock producers in the areas where this tick is found. And so this is something that is being very actively monitored. I know we had one question come in earlier before the webinar asking about up-to-date maps. This map right here came from the University of Tennessee Institute of Agriculture. They're the ones who are actively kind of posting and keeping track of the current distribution of this tick species. So if at any point you need to go check to see where this tick has currently been found, want to check up-to-date maps, that can be found on the University of Tennessee's Institute of Agriculture website. And so with that, I'm going to move into the third and final part of today's presentation, which is how can we protect ourselves from tick bites? So now that we know a little bit more about ticks, different tick species, different tick-borne diseases, what steps can you actually take to protect yourself from tick bites? And to split this up, I'm going to kind of divvy this up into 3 different categories: understanding, preparation, and reduction. And to start with understanding, we're going to be talking about how can we use our understanding of tick behavior and where ticks live and what they do to help prevent tick bites. And the first thing I want to talk about here is when you're actually going to be at risk of getting a tick bite. So when are ticks most active? So there's a lot going on the screen right now. I'll break it down for y'all. What you're looking at are 3 graphs. The first graph is for Lone Star ticks. The middle is for American dog ticks, and the bottom is for black-legged ticks. And what these are showing is they are showing for the duration of the year, so from January to December, what time of year the different life stages of these ticks are going to be most active. So what time of year are they going to be out looking for a host animal to feed on? And as you can probably notice, there is a pattern here. So many of these tick species are going to be most active in the late spring to summer months. So think mid-April or so through the summer. That is when most ticks are going to be most active in looking for host animals to feed on. With that, if anyone is paying very close attention to this slide, you may notice that there is one exception to this, and that is this little bump right here. So that is for black-legged ticks or deer ticks. They are the exception to the rule. The adults for that tick species are going to be most active actually in October and November. So whereas other tick species in life stages will be most active in the spring and summer, the adult black-legged ticks are going to be most active in October and November. That being said, just because that is the time of year when these ticks are most common, that does not mean it is the only time that they can be out and looking for an animal to feed on. The general rule of thumb, specifically for black-legged ticks, is that tick questing activity can occur anytime the temperature is above 40 or so degrees. So let's say we have, a particularly warm day in January or February, even though that is not the normal time of year when you'd expect to see a tick, ticks can still come out and quest and look for an animal to feed on during that time as well. They do not go into a full hibernation or anything like that, so they can still become active and be trying to bite a host animal even during times of year when you may not expect it. And the other thing I'll mention here is, where do you actually find ticks? So what does tick habitat look like? One thing when it comes to ticks is that while they are very tough creatures, they are very sensitive to drying out. Most tick species do not handle direct sunlight or low humidity very well. And what that means is that a lot of the areas that you'll find that have higher tick populations or are tick riskier are going to be places that are a bit more covered, have a higher humidity, and have more shade or places for these ticks to spend time. So that could look like forested areas with a lot of canopy cover. That could look like places with dense leaf litter or understory. But it could also look like tall grasses, fields, pastures, prairies. All of those could be potential tick habitats and places where, if you're going, especially during the spring or summer, you may encounter a tick. So with that, I'm going to move on to our next category of tick bite prevention here, which is preparation. And so what this is how can you prepare to be in a tick risky habitat? So let's say you are going out into the forest, say in June. You're going to be in an area and at a time where the risk of getting bit by a tick may be higher. So what can you do to prepare to be in that tick risky habitat? And the first thing you can do, it just has to do with what you're wearing. So this is something you've probably heard before, but if ticks can't get onto your skin, they cannot bite you. So doing things like wearing long sleeves, long pants, tucking your pants into your socks or your shirt into your pants can help reduce tick access points to your skin and reduce the likelihood that a tick will bite you. Another thing to keep in mind here is that ticks are going to be a lot easier to spot on lighter colored clothing, like this image right here in the center, than they are on darker colored clothing. So just keeping in mind that if you're wearing, say, tan pants out into the forest, it's going to be a lot easier to spot ticks crawling on you than if you were wearing denim, camo, or darker colored clothes. Another thing you can do when you're out to help prevent tick bites is using an insect repellent. And a repellent is very simply any chemical that can repel or keep away pests. And there are a lot of different insect repellents out there, a lot of different tick repellents out there. So how do you know which is right for you or which one you want to use if you're out trying to find a repellent? In order to do this, the main thing you're going to want to look for is the active ingredient listed in the repellent. So any repellent that you buy at the store should have an active ingredient listed on the label. And the active ingredient is the component of the repellent that is really doing the work of repelling the ticks, mosquitoes, whatever other kinds of biting pests you want to keep away from yourself. And there are several different active ingredients that are EPA registered and approved for use for repelling ticks and mosquitoes. So I've got those up on the screen right here. And some of these names you're probably familiar with. To go into a bit more detail about some of them, the first one on the list is DEET. DEET is the repellent that's been in use for the longest. It's got the most safety and efficacy data behind it, and it is generally going to be the easiest repellent to find in stores. And it can be very effective at preventing mosquito and tick bites, as well as bites from other different sorts of biting pests. However, if you do not want to use DEET, there are other different EPA-registered repellents out there. The second one on this list is picaridin. Picaridin is becoming more and more common. It used to not be super commonly found in stores. It is becoming a little bit more common now, and it has a similar efficacy to DEET. It tends to last about as long, but it doesn't have the kind of greasy texture or the smell that DEET has. So if you're looking for a repellent option that doesn't have that feel of DEET, picaridin could be another option there. And beyond that, there are also several other EPA-registered repellents as well. IR3535, oil of lemon eucalyptus, 2-decacone are all different repellent options that have been tested and that are registered. One specific one I'll note here is oil of lemon eucalyptus. You can find repellents out there that contain oil of lemon eucalyptus, but these are different from oil of lemon eucalyptus essential oils. Essentially, the repellent versions just have a higher concentration of the molecule in oil of lemon eucalyptus that can repel ticks and mosquitoes. And you can buy that, again, in repellent form in many different stores and online. So just want to make that note that that is a repellent that can work well for repelling ticks and mosquitoes, but it is different from the essential oil. And along that note, we often get a lot of questions about sort of DIY essential oil blends. So how well do they work? Can they work for preventing tick or mosquito bites? And the general rule of thumb here is that because a lot of these blends are not tested, they all contain different ingredients. We do not know how effective they are. They may be ineffective as a repellent or potentially dangerous if misused. So we always recommend going with one of the registered repellents on the previous slide, as opposed to a DIY essential oil blend if you can. Another thing about the oil blends as well is that essential oils have a very short evaporation point, which means that they evaporate very quickly, which is one of the reasons why they're nice to use around your home, or whatever you want to use essential oils for, because they evaporate very quickly. They smell very nice. But that doesn't work as well for repellent because it means that they evaporate really quickly, and any repellent properties that they have can go away very fast. Just another note there. But with that, some other options that are out there beyond just the repellents we just talked about is treating clothing with permethrin. So what is permethrin? This works a little bit differently than your DEETs, your picaridins, your other repellents, because it is actually used to pre-treat clothing before you wear it. Essentially what you do is you take the clothes that you want to wear outside into a ticky area, and you take them outside, you lay them on the ground, and you spray them down with permethrin like is being done in this image. After that, you hang them out to dry, and once the clothes are dry, then they're good to wear. So why would you want to do this as opposed to using another repellent, right? Because this is extra steps, right? You have to take the clothes that you're going to wear, treat them, wait for them to dry, then you can wear them. It's a whole extra step. And there's a couple of reasons why. First off is that these work very well for preventing tick bites because of how permethrin works. Permethrin will act as both a pesticide and repellent for ticks and mosquitoes, and it works via contact. So essentially what will happen is that when ticks start to crawl onto fabric that has been treated with permethrin, it will affect the parts of the tick that are coming into contact with the pants and cause them to fall off before they have a chance to attach. And because ticks cannot fly, they cannot jump, this can make it particularly effective for preventing tick bites. Another thing to keep in mind with permethrin is how long it lasts. So clothing that is treated at home with permethrin, which is what I described and what's being shown in this photo, will generally stay effective for about 5 washes, which means that you don't need to reapply every single time you go outside. You can treat your clothing once and then be good to go for a while. If you do not want to treat your clothes at home, there are also options for either sending clothing out to be professionally treated or buying clothes that have been pre-treated with permethrin already. And the treatment on those clothes will last a lot longer. So with that, last note that I'll make here is that if you are going to be treating your clothing with permethrin, if it's something you're interested in doing, one note is that permethrin, when it is wet, is very toxic to cats. So if you are treating clothing at home, you want to make sure that you're doing the treatment away from anywhere that cats could be, and that the cats are not coming in contact with any clothing or the permethrin while it is still wet. And so with that, to give you an idea of what this looks like, put a visual to the words, I'm going to show a brief video. And in this video, on the left side of the screen here is a pant leg that has not been treated with permethrin. And on the right side is a pant leg that has been treated with permethrin. And at the bottom of the screen here, these little black dots, those are all ticks. And when we press play on the video, you can see that those ticks on the pant leg that have been treated start to fall off as they are exposed to that permethrin and as they start to come into contact with it. All right, so a couple of other tips and tricks for if you're spending time outdoors. First off, if you are in a very, very ticky area, let's say you're going somewhere, you've been there before and it's just going to be crawling with ticks. One thing you can do to help prevent tick bites is to bring a lint roller or a piece of duct tape with you. And what this is for is you can use this to stick the ticks off of your pants before they have a chance to attach. This will not remove attached ticks, but if you are in an area where you're, kind of having to constantly check yourself for ticks, try to wipe the ticks off of your pants, this can be really helpful for making sure that you get those ticks off of you and making sure you don't accidentally brush them and they end up on your hand or they end up somewhere else. It can be very nifty in those areas. This photo over here on the right, that's actually a photo from when I was doing some work out in Southwest Missouri. I was in some cattle pastures, somewhat near the Oklahoma border down there. And that was from about walking, I believe it was about 30 yards through these cattle pastures. Those were all the ticks we stuck off of our pants during that time. So for situations like that, it'd be very difficult to brush off all the ticks and make sure they're all gone. And that's when the tape or the lint roller can come in handy. Another thing to keep in mind is that if you are specifically working outdoors, so let's say you are spending a lot of time working in the woods or in a cattle pasture, if when you're able to, obviously this is not always the case, but when you're able to, it's always great to work in a tick-safe zone. So once again, this is an image from when I was doing that work down in Missouri. And whenever we had to stop, let's say we had to reorganize our bags, we had to find something, we had to write something down, we'd always try to do that on the 2-track roads or in the gravel or in areas that would be less ticky, as opposed to out in the prairie that in areas that were more ticky. And this was done to kind of help reduce the amount of time we're spending in these really tick-heavy areas. So if you're doing a lot of work outdoors and a lot of areas with ticks, just keeping in mind that when you can kind of stop and reorganize in places with less ticks as opposed to places with more ticks, that can help reduce your chances of getting bit. All right, and another thing I will talk about here very briefly is during this presentation, I'm talking mostly about human health and ticks that affect people, but ticks will also bite your pets, right? Ticks can also bite dogs, cats, and other animals at home. So just keeping in mind that there are a lot of tick preventative options out there for pets. There are oral medications, tick collars, vaccines, topical treatments. So we always recommend just talking with your veterinarian about what options out there may be best for your pet and the lifestyle of your pet. The other note I'll make here when it comes to tick preventatives for your pets is that if you are treating your pets with any of these products, just always make sure that you are using products that are labeled for the kind of animal that you have. So dog products always go for dogs and cat products always go for cats. Once again, the reason we bring this up is that there are many dog tick and flea prevention products that are toxic to cats. So if you're using these, you just want to make sure you're using them on the animals that they're labeled for. All right, and the last little section that I would have for the preparation area is on tick control. And I'm going to be giving a very brief overview of tick control and tick management here because tick control and management can be its own separate hour-long presentation or webinar. There's a lot of info around about tick management and tick and property control for ticks. And the main takeaway when I'm talking about these different tools and strategies for tick management is that there really isn't a one-size-fits-all tool for tick management. A lot of tick management is really based on IPM principles or integrated pest management, where your best shot for controlling ticks is going to be combining multiple strategies in thoughtful ways to help manage ticks in an area. So with that, I am going to give a very, very brief overview of some tick control or tick management options out there. The first being landscape management for ticks. So one way that if you say have a property and you have areas that are very ticky, you're encountering ticks in your yard, one potential option for helping manage those ticks is reducing the amount of habitat available for them. So doing things like clearing undergrowth and brushy areas, removing leaf litter, could help manage ticks in an area. But you may be thinking that this is something, right, that is not always feasible in all places and not something that we always want to do, right? There are often times in places where we want to keep leaf litter and we want to keep undergrowth and brush and these plants in certain areas. And so one way you can think about landscape management for ticks is creating what we call tick safe zones. Essentially what this is just being mindful of where, let's say in your yard, people are spending a lot of time and clearing some of this undergrowth and brushy areas specifically in those spots. So let's say, in this image, there's a playground, there's a patio, taking some steps to manage the landscape and kind of clear those factors that can influence tick populations around areas where people are spending a lot of time, and leaving them in areas where people are spending less time can help reduce the chance of people encountering ticks while in the yard and reduce the chances of tick bites. So another option for tick control out there is tick control specifically focused on the host animals that these ticks are feeding on. And so one example of this are tick tubes. So you haven't seen a tick tube before, there's an image of it on the left. Essentially what these are is they are cardboard tubes that are filled with cotton that has been treated with an insecticide. And how they work is that homeowners can deploy these or set them out around their house, their yard, whatever place it is that they want to try to manage ticks. And how they work, and I have a short video here showing this, is that when these tubes are placed outside, mice will come in to grab the cotton for these tubes to use in their nests. So that's what's going on in this video right here. A mouse is coming in, grabbing the cotton from the tick tube to take back to its nests. When the mouse does this, the insecticide that is on the cotton will go onto the mouse and will kill any ticks that are attached to the mice. And in the Northeast in particular, a lot of ticks, specifically black-legged ticks and deer ticks, will feed on mice, specifically the younger life stages, so like the larval ticks. Mice are going to be the main host for that life stage. So this method can help kill ticks on the mice before they have a chance to grow up and develop, and it can halt the growth of tick populations. And we see a raccoon came into the video to check out the tube after this as well. Other animals will also come and check them out. But take-home message here is that tick tubes are a tool that can be used to help manage ticks in an area, and it is a tool that is very specific for ticks. A lot of tick management strategies will affect, what we say have non-target effects. This is something that is very specific for the ticks or other ectoparasites that are on the mice. All right, and then last thing I'll talk about in this little section, and then we'll start wrapping things up so we have a bit of time for questions, is chemical control or using pesticides for ticks. There are various pesticide options for ticks available. These are often called acaricides. You can find synthetic acaricides, which are usually pyrethroid containing products. And you can also find pesticides out there with 25B products. So a few things to keep in mind if you're using pesticides for tick management. First off, as always with any pesticide, you're always going to want to read and follow all labels. Another thing to keep in mind is to just be aware of non-target effects. Different acaricides or pesticides for ticks are not going to be specific for ticks. They will often also affect other non-target insects or arthropods in the area. So if you are wanting to spray for ticks at all, you want to be very specific and know where you want to spray. Find the area in your yard or on your property where the ticks are and be very intentional about where you actually want to apply the pesticide. And then lastly, as always with using pesticides, they should also be used in coordination with other control methods. And so lastly, to wrap things up before we get into Q&A, the last section we're going to talk about here is reduction. So this is essentially after being outdoors, how can you reduce the risk of getting tick bites or tick-borne disease? So to go back to our example before, let's say you're going into the forest, it's June, you know you're probably in an area with ticks, maybe you used a repellent, maybe you wore long pants, you took some steps to help prevent tick bites. But even after coming indoors, what can you do to help reduce the risk of getting bitten by a tick? And the first thing I'll talk about here is doing tick checks. So if you've heard one thing to reduce the chances of getting a tick bite or a tick-borne disease, it is doing a tick check. Tick checks done within 24 to 36 hours of being outdoors can help reduce your risk of getting a tick-borne disease. And ticks, they can attach anywhere on the body, but they will tend to prefer areas that feel a bit more covered or enclosed. So that could be in your hair, it could be around your ears, under your arm, around your waistband. Those are all areas where ticks may preferentially prefer to attach. Another thing to keep in mind when you're doing a tick check, just know your freckles and moles. Ticks can be very, very small, especially those younger life stages, and they can be a bit difficult to find. So just know that when you're looking for ticks, they can be tiny, and it can sometimes take some effort to find ones that are attached. A few other tips and tricks for when you're coming indoors after being in a ticky area. First off is if you were in a really ticky area and you are concerned about ticks possibly hitchhiking inside on your clothes or on your gear, one thing you can do is you can place the clothing you wore outdoors in a dryer for about 10 minutes on high heat. This will kill any ticks that may still be on the clothes, may have hitchhiked inside before they have a chance to get on you. After you put your clothes in dryer, then you can go ahead, put them in the wash, do whatever you need to do. But the washing machine on its own may not always kill all the ticks, so we always recommend just putting them in the dryer if you are concerned about ticks kind of hitchhiking inside. Another thing you can do is really simple, just taking a shower. Showering within 2 hours of coming indoors can help reduce your risk of getting bitten by a tick. This will not remove ticks that have already attached, but if there are any ticks that are still crawling on you and haven't quite attached yet, this can wash them away before they have a chance to do that. And then last thing I'll mention here is tick removal. So if you do find a tick on you, the big thing is you're just going to want to remove that tick as soon as possible. It takes time for a lot of these tick-borne pathogens to be transmitted from the tick into the animal that they're biting. So the sooner you can find and remove attached ticks, the better. And when we're talking about tick removal, generally the simplest method is going to be the best. You're going to want to go in with a pair of tweezers if you've got them and grab the tick as close to the skin as possible, and then pull up with a steady, even pressure. You want to grab close to the skin and not further back in what we call this no squeeze zone on the screen, because if you grab the tick further back, it increases the possibility of you accidentally tearing the tick in half and leaving some of the mouth parts embedded in the skin. So you're going to want to grab as close to the skin as possible and pull straight up. And finally, to end with one last video, I do have a video of what this looks like that one of my colleagues took. And as you can see in this video, she has some ticks that are attached on her skin right there. And she's going to go in with a pair of tweezers. And as she goes in, she's going to grab the tick as close to the skin as she can and pull up. And you can see it does take a little bit of effort to actually remove these ticks. They can really embed themselves in the skin. But with a little bit of patience, putting a little bit of muscle behind it, you can get a tick out all in one piece doing this. And there we go. All right. And so finally, to wrap things up before we hopefully have a little bit of time for Q&A, I will mention a lot of the things that we talked about, and you might have noticed, a lot are very specific for things that you can do, right? There are individual steps that you can take to help prevent tick bites or reduce your risk of getting a tick bite when you're outdoors. So I always like to end the presentation, kind of co-op Smokey the Bear a little bit and say only you can prevent tick bites. So hopefully you left today's presentation knowing maybe one or two more tips or tricks for preventing tick bites, and can walk away with some knowledge you can take with you the next time you're spending time outdoors and enjoying the nature in New Jersey. And so with that, to wrap things up before we get into Q&A, here are my references, image credits. I will do a quick plug that if you are interested in learning more about ticks, tick-borne diseases, and other vectors and vector-borne diseases, we are running a monthly webinar series right now at Penn State Extension on biting pests. So these are monthly webinars about ticks, mosquitoes, and other biting pests. Some of our webinars are Pennsylvania specific, a lot are not. They are free and open to anyone. So if you're interested in learning more about these topics, I have some of our upcoming webinars, topics, and dates for the ones that we have dates for on screen. Our next webinar is going to be on Wednesday, actually, of next week, about longhorn ticks and cattle health. So if there's anyone here who works with livestock, you may be interested in that one. Then we also have some webinars coming up on West Nile virus, New World screwworm, and tick-borne disease prevention while hunting. So if you're interested in any of those, you can find them on the Penn State Extension website. They'll all be listed there. And so with that, once again, that's all I've got for today. Thank you all so much for tuning in and joining me. I really appreciate it. If anyone has any questions that we do not get to during today's presentation, once again, my email is up on the screen. And then if you all have ever listened to an extension presentation before, you know we evaluate everything. So if you'd like to fill out an evaluation, let me know what you think, ideas for topics for other tick-borne disease presentations or programs. There's a QR link on the screen. Please feel free to fill it out if you have any feedback. Thank you all.
Emily, do you want to stop the share?
Yes, I can do that.
Thanks.
There we go.
Okay. So first, I just wanted to thank you so much for a great presentation. I also wanted to thank Andy Bennett, who will be helping us with the Q&A. In the next few minutes, Andy is a fellow director at the NJFA and a New Jersey approved forester. So Andy, when you're ready, I went through the questions and tried to find ones that we may not have touched on. One I thought was interesting was, what's the best tick bite prevention for children? Is there anything different that one needs to do?
That's a great question. So a lot of the tick bite prevention methods that we talked about, so, wearing longer clothing, the different repellents that are available, children can also use. The only thing I'd mention is that for the different repellents, so things like DEET, picaridin, things like that, is to just double check the label for what ages they're approved for. I can double check real quickly. Most are approved for ages that are pretty young. The one exception, though, would be repellents containing oil of lemon eucalyptus. So repellents that contain that are only approved for use on people aged 3 or older. So that's kind of
use them in accordance with label directions and never exceed the amounts. If there are weight limits and things like that, be very careful about them. But I thought it was a great question.
Yep, yes, it's a very good question. Thanks for asking that.
When you were talking about the time, the 36-hour time to remove the tick, I know that there are some shorter time periods attributed at this point to alpha-gal. Is that correct?
So for alpha-gal in particular, I'm not familiar with the transmission time of alpha-gal off the top of my head. So I'm not sure about that one. I'd have to look it up. But there are some tick-borne diseases, yes, that can transmit in shorter periods of time than the 24 to 36-hour range that is often given. Another example of a tick-borne disease that can be transmitted in a shorter period of time is Powassan virus, which I mentioned very briefly. And Powassan virus, it is known to be transmitted in as little as 15 minutes. So there are certainly tick-borne diseases that are exceptions to that rule for how quickly they can be spread from the tick.
You mentioned testing that could be done on humans to see if they have Lyme disease or other diseases. Is that pretty reliable? Has it become more reliable?
Yeah, great question. So for Lyme disease testing in particular, the antibody tests are quite accurate. The only note with the antibody test is because it is testing for antibodies and not the bacteria of Lyme disease, is that how accurate they are is somewhat dependent on how long ago the infection began. So if the Lyme disease infection only began a week ago, the test is going to be less accurate than if, the infection started 4 to 6 weeks ago.
I'm just running down the list. Andy, do you want to ask any questions about
Yeah,
invasive plants or other things
yeah,
that you encounter in the woods?
yeah, Emily, I don't know if you hit specifically like invasive plants in particular, Japanese barberry, and if there's like a direct linkage between tick populations and the density of barberry you may have in your forest. What would you say about that?
Yes, yeah, very good question. Yeah, something I didn't touch on too much, something I didn't touch on in this webinar. But yes, one of the plant species that has been specifically noted to link to increased tick abundance is Japanese barberry. We do find in places that have very homogeneous stands of barberry, so places where it's kind of taken over the forest floor, do tend to have higher tick populations. The reason it's believed that that happens is actually because, once again, of the mice. So Japanese barberry stands, when they're very thick, when they're very dense, can provide great mouse habitats. And when you have more mice living in these areas and habitats that are already good for ticks to begin with, it can cause an increase in tick populations. So yes, the link between Japanese barberry and specifically black-legged tick populations is something that's pretty well documented.
This was a question I saw in the chat. So somebody's using, I don't know how you pronounce it, permethrin. Somebody's using that to treat their clothes. The question was, is there an advantage to then layering on top of that another treatment like DEET or something like that? Is it like the more the better, or are we just kind of using too much, I guess?
Yeah, you can if you want. So permethrin and DEET work a little bit differently with how they repel or keep away ticks. Permethrin, like I said, works through contact. So it works mostly when ticks come in contact with the clothes. It causes them to fall off before they have a chance to attach. DEET and other repellents are olfactory repellents. So it'll keep ticks, mosquitoes away because they'll sense it, they'll smell it, and then they'll stay away. So they do work a little bit differently. So there could be utility in layering them on top of each other, if you want those kind of two different layers of defense going on. That being said, and it is up to you. It is up to the person. It may not be necessary to layer in all situations, but they do work a little bit differently.
One of the things I've noticed in watching the chat is there's a lot of comments that some are less science-based than others. And I think people should be very careful about reading up at correct qualified sites such as your website, Rutgers website, CDC, Department of Health, places that have known reliability components in them, because it's very easy to get trapped in these conversations that are, people are suffering with an illness and they're looking for solutions, and sometimes those solutions are not from reliable sources. So I think it's very important. You focused on that in a couple of ways, but I thought I'd bring people back to that as a comment.
Yep, absolutely. And I'll plug once again, essentially I work for Extension. Extension folks are really great at directing you to where you need to go. So if they don't have the answers, they're very good at telling you where to go. So absolutely reach out to Rutgers Extension. There are great folks there. They have great resources on their website. If you are looking for more information about this or more.
Do you have any familiarity with the sites which permit you to send in ticks for testing or species identification?
Yes. So once again, since I'm from Pennsylvania, I'm familiar with the Pennsylvania specific ones. I do believe the Rutgers tick lab that was put in the chat earlier, I do believe they are accepting tick submissions. So that is one place where you can send ticks. Yeah, Ticks for Science was mentioned. So those are resources that you can go to submit ticks for identification if you're interested. These do tend to be somewhat state specific. So a lot of times kind of like states will have their own either tick identification resources, or there are other kind of more national labs that you can go to for ticks for pathogen testing. But yeah, I would say for New Jersey, once again, Rutgers would probably have that information or have those resources.
Andy, you look like you're looking at a question.
No, I think interesting, just simple practical stuff. I personally use permethrin on my clothes, and I do find it to be very, very effective when working in the woods. Somebody's just asking a practical question. When you wash your clothes, dry your clothes, should you be doing that separately from everything else?
I mean, you
Oh,
treated versus untreated
Yeah,
clothes.
correct. Yeah, I'm sorry.
yeah, I usually, when I will wash and dry my methylene treated clothes, I usually do it separately from the rest of my laundry, just to kind of keep everything together. I also have cats at home, so just as an extra barrier of making sure that that wet permethrin isn't coming in contact with my cats,
Mhm.
I'll usually do a load of laundry. That's just all of my permethrin treated clothes, and kind of keep those separate from everything else.
Just went through the questions, and you look like most of them were answered.
Yeah, somebody just asked about natural predators and just that eat ticks. I also was just thinking like what is it? Guinea hens, you hear like eat ticks. Is that true or
Yeah, so when it comes to natural predators for ticks, I guess the unfortunate thing with ticks is there really aren't many natural predators for them. There are animals where if they encounter ticks, they'll eat them. So, for example, chickens, guinea fowls are an example of that, where, if they happen to come across a tick in the area, they'll eat them. However, chickens, guinea fowl, possums, like someone just put in the chat, they are generally not going to be eating a ton of ticks, or at least not enough to be controlling the population. There have been some work done on that recently, trying to figure out, what impact they can have on the populations of these ticks. And generally speaking, yeah, they're not going to be eating enough to have a big impact on them.
Well, there have been several questions also about the recording of this presentation. We post all the presentations on our YouTube page, the New Jersey Forestry Association YouTube page. There's a complete library there of all of our presentations, and this is no exception. It will be up on the site shortly.
I was reading through the questions that were posed when people signed up, and one of them was about oh Jewess, I just lost it. Oh, I know. Like time of day. Like are ticks like working at night and working during the day or like is there a good time to be out in the woods and not?
Yeah, great question. When it comes to time of day when you see ticks, ticks can be out and about really through any point of the day. The one time of day where at least I've experienced that we'll sometimes see less ticks is if it is a very warm summer day and you're out in like the middle of the afternoon, it's really sunny, it's really hot. Um, we do tend to find less ticks during that time, likely because it is just too hot, too much direct sunlight for them. But other than kind of that exception, I believe we can tend to find ticks most of the time during the day.
I see someone posted the Rutgers extension link. They are saying we do tick IDs.
Okay, perfect. I thought y'all did, but I didn't want to 100% promise if I wasn't entirely sure. But yes, thank you for chiming in with that. Wonderful.
That was an interesting question about permethrin, which is, does it last in essence forever, even if you don't wash, or does it have to be renewed periodically?
Ooh, I do believe it does have to be renewed periodically. I am not sure of the exact time frame for, like if you treat your pants, then I never wear them, how much does it need to be retreated? I cannot recall the exact time frame off the top of my
Yeah, I
head,
think
but
you
there's a
can get
point where
some.
you do have to renew it.
If you go online and look at the sites that do the commercial treatment, if you mail in your clothing, they give facts about durability of the treatment and longevity of the treatment. I think that would be a good place to consult. But they're relatively expensive for those treatments. So spraying yourself is probably the easiest unless you're going through a lot of clothing.
There's a good question. It says, I like that. Before Lyme, the only concern was Rocky Mountain fever. Now there are many more tick-borne illnesses. Is it because our diagnostics are better, or is there another reason? Has it been here and we just didn't know it sometimes, I guess?
Yes, yeah, great question. So for a lot of cases, yes, it's going to be because our diagnostics have gotten a lot better. Lyme disease has been around for a very long time. We have records of the bacteria that causes Lyme disease back thousands of years. It's been here for a while. But yeah, it's only been with improved diagnostics and improved understanding that ticks can even cause disease, because that wasn't really well known for a long time either. People didn't know that ticks could, lead to a disease at all. And so with our better diagnostics and better understanding of how ticks live and how these pathogens are transmitted, yeah, that's how we're kind of discovering new tick-borne diseases and learning more about what's actually out there.
I think also there was a change at the CDC, and I forget the year. I just have a note here somewhere. In 2022, they went to laboratory-based surveillance, and
Yes.
that changed completely how the data was assembled and analyzed. And New Jersey moved from like number 10 to number 3 or 4 when they went to laboratory-based surveillance. So these changes in the methodologies of the high-end testing really have altered the detection scenarios as well as the frequency of illness scenarios. So those are some of the factors that changed the data set.
Yes, yeah, absolutely. If you're looking at, like you mentioned, specific tick or Lyme disease, reported cases of Lyme disease or Lyme disease surveillance data over time, and you notice, like you said, a big spike in 2021, 2022, that is from the changing case definition. So it's not necessarily that a ton more people were getting Lyme disease in that specific year. It's just as being reported and diagnosed a bit differently. Yeah.
So there was a question we sort of avoided, but it's come up a lot, and I think it's probably like an overarching question for everybody. Do cold winters affect ticks, and do warm, hot summers, wet springs, there's all these people with farmers' almanacs out there saying, well, it's going to be a dry spring, it's going to be this, we'll have less ticks. And is there any truth to any of that?
Yeah, it's a good question. And the thing when it comes to ticks is that a lot of the ticks that we see in the Northeast live for 2 years. So they can live to withstand the winters, right? They're usually living through 1, maybe 2 winters during their lifespan. The big difference that we see with the specific, weather patterns of a certain year and for the impact it has on ticks is just how active they are with searching for hosts. So for example, if you have, a warm spell in the middle of February, you can have a bunch of ticks that come out and start looking for an animal to feed on and are more active than you would usually if it stayed colder. Same with if you have a bit wetter of a spring, or maybe you have a warmer spring, the ticks can be out and looking for animals to feed on earlier than they usually would. So it may not necessarily be that there are more ticks out there or a higher population, but the ticks that are out there could be more active and can be looking for animals to bite at different times of year than you'd normally find them.
How about you, Emily? Have you ever had a tick-borne illness, Lyme disease, or any of the others?
Yeah, so I have not had a tick-borne illness. I've been very lucky. I've been bitten by many ticks, mostly actually before I started working with ticks. Once I started working with ticks, I got much better at kind of keeping them away from me or off of me. So I've encountered many ticks in my years. I still, as part of my job, I go out and collect ticks every day. I was collecting Asian longhorn ticks this morning out in Pennsylvania. But yeah, I've never myself had a tick-borne disease. Been very fortunate.
We're in good shape, Andy?
Yeah, I mean, I think you kicked butt, Emily. That was really, really good presentation. Yeah, very informative.
Thank you so
Thank
much.
you so much. I love the energy. Thank you very, very much.
Yeah.
Really,
Yeah,
for a
thank
lot of
y'all.
content, you moved it right along.
Yes,
I think the
we keep
audience
things
really
moving.
appreciated it. And don't forget to contact Emily if you have any questions or just want to send her a note of thanks. That would be great. And Emily, thank you so much for helping us out with this presentation. Super well received, and hundreds of people on the Zoom. So really fantastic. Thank you.
Thank you.
Yeah, thank you again for the invite, and thank you for everyone for tuning in on your Thursday night and spending your evening learning about ticks. We appreciate y'all being here.
Thanks, Emily.
Thank you, Andy. Good night.
All right, see y'all.
All right. Good night, Emily.
Bye.
Good night, everyone.